Hi, okay, let's get started. My patient is 33 years old, G2P2. Yesterday she had a repeat C-section with a bilateral tubal at 39 weeks and 2 days gestation, and it was around 12:50. She has no known allergies, no use of substances, alcohol, tobacco. She is a full code. With her last C-section before this one, she had twins, and one baby was breached, so that's why they decided to do the C-section last time. This time, however, she wanted that tubal, so she's decided to go and have a C-section again. It is a low transverse incision. Artificial rupture of membranes was done yesterday, and liquid was clear. Baby boy was in vertex position, left occiput anterior. The placenta was removed manually, and it was all intact. Estimated blood loss was about 671 milliliters, and weighted blood loss was 114 milliliters, with the total being 785 milliliters. Mom is now postpartum day 1. She is stable, managing pain very well, ambulating, and she has decided to formula feed her baby. She does have that IV saline lock still on. I removed her Foley cath earlier today per doctor's orders, and in the bag there was only a little bit of urine noted, and it was amber colored, and she has urinated 3 times for me today, but each time it has been in small amounts and very amber colored, and she has not had a bowel movement for me. She will be approximately here for another 2 days if everything goes good. She does have a history of taking SSRIs. But with baby, she's been doing very well. No complaints of feeling overwhelmed, stressed, anxiety. I have asked her how she's doing, and just no complaints. She seems to be really involved with her baby, and so does dad, and they seem to be bonding very well. Fundus is firm at midline. Her lochia is scant and rubra. Her C-section incision is dry, intact, no drainage or foul odors noted. There is a tiny bit of swelling present. Her pain, she says her pain feels better when standing, so she's been walking around a lot today. She says it just relieves it. No complaints of breast pain, no redness noted or swelling. I administered an antihistamine this a few hours ago because within that spinal block and morphine they gave her yesterday, she's been feeling super itchy. So we just I just gave her that antihistamine, and it's been doing really well. Also, it'll help dry up her milk. So if you want to give her another one in 3 hours, you can, if she's still feeling itchy. Mom's last vitals, BP was 115/72, heart rate 78, respiratory rate 16, temp 37.4 Celsius, and an O2 of 95%. So that's about her baseline. So now just be aware of that. Baby boy was delivered through that C-section. Apgars were 8 and 9. He weighed 9 pounds and 3 ounces, so he is considered LGA. His most recent vitals were temperature was 36.5 Celsius, heart rate 130, and respiratory rate 44. Baby has been feeding very well every 2 hours. His last feed was about an hour and a half ago. Tolerating feeds very well. He had his first meconium this morning, and since then he has went 2 times, and the last one was around 15:45. He's avoiding appropriately. Mom and dad are very attentive to baby, and mom has done frequent skin to skin, and has been, each time I go in there, she's holding him. We did have to monitor baby's blood glucose because due to him being LGA. His last one we got at 12, and it was 54. So he's no longer on those screenings, so he did really great. So that's about it for baby. Priority problem number 1 that we were managing was postpartum hemorrhage. Because she did have a lot of blood loss, it was an expected range. It just puts her at the high risk. She had the C-section, a repeat C-section, and baby was LGA, just putting her at high risk of postpartum hemorrhage, so I monitored that. I did fundal assessments, every 4 hours, monitoring lochia each assessment, vital signs every 4 hours, and monitored for any signs of excessive bleeding. I also kept that IV saline lock in just because, as of right now, it's good to do that. I educated the patient to use the call light if they feel any gushes of blood or lightheaded, confused, dizzy. Also educating Dad if he notices her feeling any or notice her acting differently, go ahead and press that call light and we'll come in and assess. Patient remained stable throughout my shift. Fundus was firm, like I said, midline, lochia, scant, and rubra. No signs of postpartum hemorrhage found. However, by doing this, it's going to catch it earlier if it does happen, and hopefully we can intervene and manage it and get her within stable. And also it's going to prevent any hemorrhages by going in there and assessing and getting those fundal massages done. The second priority that I managed was infection risk. Because of her C-section incision and her having a Foley cath, it just puts her at higher risk. So this was priority number 2. During those fundal checks, just assessing that incision, making sure there's no signs of infection, like redness, swelling, or drainage, foul odors. Monitoring temperatures and heart rate while doing those vitals, making sure she looked stable. Also monitoring baby's vitals and making sure baby wasn't tachycardic or had a fever. Another important thing is hand hygiene. Whenever touching mom and touching other things, always putting on new gloves and cleaning my hands is very important within this infection. Prevention precautions. Patient did remain afebrile throughout my shift. Incision was clean, dry, intact. However, by maintaining infection prevention precautions and just monitoring her, like with postpartum hemorrhage, we can intervene. I can intervene if something does happen all of a sudden, and we can have precautions so then mom doesn't have infection and grow sepsis or even die. So those were those 2 priority things that I was managing. The safety considerations were monitoring PPH and infection. Also, with mom having that C-section, it's important we put her on fall precautions just because it's hard to walk after you have a C-section. So making sure she had on those non-slip socks, she's using her call light, we were helping her ambulate when needed, making sure her husband's aware of kind of what's going on. That was very important. Also, pain control. We don't want mom in pain, so I was making sure she wasn't in awful pain and keeping those meds up to the time and giving them to her. Newborn safety as well as mom safety was those tocos, making sure those were on every time going into the room and looking at their wristbands, making sure we're giving the right meds, we're with the right patient. Charting on the right patient is very important. Also with baby, thermoregulation is big. Baby did really well though, always seemed to have a good temp and wasn't a fussy baby, so seemed to be really content. Hand hygiene, always. So making sure to use hand sanitizer and washing my hands and gloves within safety considerations. We just want to keep everyone healthy. Also, with sleeping, I did educate mom. Like, if she wants to go to bed, that's awesome. She deserves to take a nap, but we would like her to put baby in the crib because we want baby to be safe, and that is the best way to do that, and just making sure he's upright. So that was awesome. And with medications, the important medications was, and the ones that we gave were Ketorolac, 30 milligrams IV push every 6 hours. The last one was given at 15:30. Motrin, 600 milligrams given by mouth every 6 hours, given at 1400. Zofran, PRN, 4 milligrams IV push given at 8, and it was last given at 800. So with the Ketorolac and Motrin, been doing really great with pain. She seems, the last time I assessed her pain score was a 2 out of 10, so she's doing really good. And I did give her the Zofran this morning because she was really nauseous, so that seemed to work really well. She's no longer nauseous. If she begins to be nauseous, you can go ahead and give her that. Baby did receive his shots and drops, so that's awesome. Mom consented. Mom's labs were overall within expected range for having a C-section. Her hematocrit and hemoglobin were the only things that were standing out, and they were lower, but they were within range for C-section, so just being aware of that. The thing, too, that we were worried about is the positive antibody screening. Infant, the only thing was the blood glucose, so just monitoring that and just assessing the baby regularly. We did have to educate Mom on infection prevention and just taking care of her incision. She was aware of it because of her previous one, so she seemed to understand that well. Just correct hygiene, even with us wearing gloves and cleaning and making sure she knows when she needs to contact someone or press the call light now that she's here if she feels anything like of the infection. Same with postpartum hemorrhage. Just like I said earlier, education on bleeding and feeling lightheaded and things like that. Even with Dad, kind of telling him what if this happens, like what they need to do. Education with hydration was also provided because her urine was darker, and I found out that she wasn't drinking water because it seemed to be making her nauseous. So just educating her, like, you do not need to just drink water. So I gave her some juice and just maybe not drinking as much, just drinking a little bit at a time of that water, and just telling her she can have other liquids, but making sure that she does get that liquid just because she does have dark urine and she hasn't had a bowel movement yet, so we just want things to be going and moving along. Also, she just verbalized understanding of all of this very well. We did have to educate her about a Tdap. She didn't have her Tdap vaccine, so I educated her that without Tdap, baby could get whooping cough, and so just keeping up on that education. If she changes her mind, just give her that vaccine. Yeah. So that was all for the education. For oncoming tasks. Okay, so continue to do those regular fundal assessments and every 4 hours and then per hospital protocol. Continue to monitor that incision for any signs of infection. Encourage hydration and ambulation. She's been doing really well walking, but just make sure she's drinking a lot of water. Keep monitoring that urinary output and hoping she gets a bowel movement. If she doesn't, she has prescribed medications for that bowel movement, so hopefully it'll get her moving. Continue pain management and keep reassessing effectiveness. Continue to assess Mom for mental health. Any social determinants of health, just monitor for it. The only thing that we noticed with that was, or the only thing I noticed with that was the mental health, but she seems to be doing really great. Continue to do those newborn assessments and support baby when needed. So overall, Mom did super great. No huge complications, so that was awesome. So thank you, and